Hello, everyone, and welcome to another segment of conversations around health equity. Really excited to be joined by Dr. Jordan Lewis, who is a professor at the University of Minnesota School of Medicine, doing great work as it pertains to engaging caregivers in American Indian and Indigenous communities. And so we're really excited and also happy National Native American Heritage Month. We know we have so much work to do to engage all communities that need us most, and any ways that we can learn and hear about best practices from experts like Dr. Lewis. We really appreciate the opportunity. So let's get it started. So Dr. Lewis, tell us a little bit about your work and maybe your journey to doing this work. It's always entertaining and intriguing to hear about journey.
Sure. Yeah. Thank you. It's an honor to be here. My journey. I'm a social worker by training. So I have my BSW, my MSW, and back when I was in that part of my educational career, was really interested in working with older adults. Being Alaska Native, being raised among my elders, having great grandparents and grandparents in my life, I think that really steered me in that direction. And surprisingly, my first internship in my MSW program was at the Alzheimer's Disease Research Center at Washington University in St. Louis School of Medicine. They have an and so that was really my first introduction to clinical assessments, learning more about the research in this area. And this was back in 1999. So I wish I would have known what I know now, but thinking back now, how it's come full circle. Right now, I'm in the research area of ADRD work. And so after my MSW, I got my PhD in community psychology at the University of Alaska Fairbanks, knowing I really wanted to work more at a community level, and how do we build upon community resources, community strengths to improve the quality of life of our elders. And so my work has been really focused on using the community-based participatory research model, engaging them throughout the entire research process. And my dissertation work was really focused on Indigenous successful aging, and really critiquing that term and what it meant, and how most racial, ethnic, minority, disadvantaged populations didn't fit that definition. But I was raised among elders who are definitely aging successfully. And so what does that look like? That work's been going on, funded consistently since 2008 by the National Science Foundation. Through conversations with communities, we started hearing concerns around dementia, cognitive impairment, and asking, what is going on? What does this mean? And even in our conversations around successful aging, this would come up, not so much in a worry or a disease, but more of like, we just want to, this normal part of the aging process. And so after my doctoral program, I did the teaching, University of Washington, Seattle, taught there for a while, and then transitioned from a school of social work to a school of medicine at the University of Washington. School of Medicine has the WWAMI program. The Washington, Wyoming, Alaska, Montana, Idaho. So when quite a few years ago, University of Washington was the only medical school for those 5 states. And so they had satellite campuses. And so I was recruited to go home to Alaska to work with the WWAMI program there.
That's great.
So it was wonderful to go home. And then I really had I was much closer to the population I wanted to work with, and was able to have more in-depth conversations around dementia, and trying to figure out, where can a project come from? How can I collaborate with these communities to really figure out what's the research question? How do we address the priorities you guys have? So I was there for about 4 years, and then got recruited here to Duluth, specifically for a center focused on Indigenous dementia, including rural communities. And through my work in Alaska, being that I'm focused on strength-based work, and definitely interested in the disease process, right? Well, how do Indigenous people understand what dementia is?
Mhm.
I was also particularly interested in how do we support our caregivers.
Mhm.
Some of the interviews I did in Alaska, their stories of resiliency, their problem solving, their innovation, and what they do to protect their loved ones was outstanding. And so that's really how I got to where I am today, is how do I take the work I'm learning around successful aging and apply that to help caregivers age successfully as well?
Yeah, I was going to ask. So, what does successful Indigenous aging look like?
Yeah, it's a great question. So in our work, we've found there are 4 or 5 main things Alaska Natives talk about in terms of what's important to them. Family support is big, of course, community engagement. And then what that means is that they're actively engaged in their community and things that are meaningful for them.
Yeah.
And they make themselves available because they want to share that knowledge, but they also state that they have to be sought after for that knowledge. They want to have the communities or families or kids ask them for stories or to come volunteer in the classroom. Another area, of course, physical health. They said, having perfect health would be amazing, usually not attainable. But if they're able to stay active and keep their health at a level that works for them, that was important. Spirituality was really important. And that's across the continuum of very traditional spirituality, which could be spending time on the land, picking berries, prayer, to more formalized religion, attending church. And then the 5th one was native ways of life, which is that ability to eat your native foods, practice subsistence activities, have those opportunities to be generative. So passing on that knowledge of your life stories, your skills, and what's important to you and what you learned over your lifetime, with the goal of helping others.
Very interesting. I tell you, the last point, makes me think of, tailoring for those of us that are, at the Alzheimer's Association, trying to get our free resources to communities that need us most, but also knowing that we've got to tailor our approaches to the needs of communities, right? And so, acknowledging that, there are strengths, which I really like that about your work, that we can capitalize and engage and build on to do our work. So thanks for that, Dr. Lewis. And so also, in our annual facts and figures, we always report that, African Americans 2 times more likely to have dementia than whites, Alzheimer's and other dementia, Hispanic Latinos 1.5 times. What do we know about the prevalence of Alzheimer's and other dementia in American Indian, other Native Indigenous communities?
Yeah, that's a great question. So from what I understand is there's not until recently are people starting to collect the prevalence and incidence data for Indigenous populations.
Yeah.
So there are some, researchers out there doing phenomenal work. Dr. Deidre Buchwald, Dr. Spiro Manson,
yeah.
Our centers thinking about doing similar work. I would say there may be other countries who are collecting that information with their Indigenous populations. Right now, I think that's a challenge for a lot of our Indigenous communities here, is because there's still that belief that it's just a normal part of the aging process. So why would you seek out something that you don't see as a disease or something that see a cure for or a need to change? I think that's a shift that may change with generation, like another generation or 2 younger people who are more aware of health literacy, what dementia is. And so, we're seeing communities and researchers trying to push, like, what are your fears, or how do you get engaged with research when dementia? Is it important to your community? How do we recruit these populations into clinical trials? To start addressing some of those things we need to have fixed. So, or just to begin.
Yeah, really, we talk a lot about, in our DEI work, disproportionately affected populations, underserved, but also underrepresented. And here, not knowing the prevalence and how it compares, to other, racial, ethnic, other demographic groups, is a I think dramatic underrepresentation of what we know in public health. And I tell you, it's a real call call to action. So Dr. Lewis, you mentioned clinical trials, and we know how important participating in clinical trials is. What has been your experience in speaking about clinical trials in these communities?
I would say a majority of the people I talk to, whether it's just around research or clinical trials, is there's still a big mistrust of the healthcare system for a variety of different reasons. Or even just current treatment of going to the doctor or going to see someone about memory care or just general health. And this fear that, they may hear the few negative stories around research or someone they know went to the doctor and it was not a good experience and how that spreads. I would again say, generationally, I think that's going to change too. If we think about the older elders that we work with, and several of the elders I work with only speak their native language. So there's a barrier, right? That a lot of this doesn't translate to a native language. And if they try, maybe it's not always translated in a way that makes sense completely. So they're not really sure what they're signing up for. And then, trying to figure out how do you make it accessible. A lot of our communities we work with are remote, geographically distanced, only accessible by airplane or boat or snow machine sometimes. And so I think when we talk to younger people who may be the caregivers that we work with, see a benefit, or they say, oh, we talked to grandma about this, and trying to figure out in this messaging as we think about when we think about encouraging Alaskans, for example, into clinical trials or research, not so much putting on the focus on their benefit, like this may be good for you for X, Y reasons, but really shifting that focus to, you can do this, we'll learn more by your experience to help grandkids or the 7th generation, right? So putting it more on this will help.
Legacy and, helping and contributing to a better future. Yes, good to hear that, Dr. Lewis. That's something. So, okay. Well, last question, and our staff, we're really, getting our momentum going as it relates to being inclusive and thinking of equity. And so, as I mentioned, we have wonderful chapters and staff and volunteers who are, trying their best to engage Native and Indigenous communities with our resources. What advice would you give them about partnering and looking to get resources to these Native communities and families?
Yeah, that's a great question. We get that a lot, and all of our research, I think, is either whether they're non-Indigenous, right, or they just want to start community, like just being in communities. Being Alaska Native and being Minnesota, that's I can't make the assumption we are all the same. My first recommendation would be to spend time in the community, right? Go out there, get to know people, bring resources, be prepared to ask questions, and not do it in a rushed manner, right? Like you want to go out, figure out who the key people are there agencies out there? And when you make promises or say you're going to come back again, make sure you follow through with those. I think that applies to a lot of communities, not just Native communities, but just that respect. And another recommendation would be, try to encourage them, let them know they're partners in whatever's happening, and they're being open to working in partnership. Maybe they want things translated, or things are maybe should be different, or they may not even know resources exist. And so coming with that information and figuring out, how do we make this accessible? What does a community-driven approach look like? The other big one I think is really important is to be okay with no. I think a lot of times we always focus on making these partnerships with the communities are just gonna, whether it takes time or not, will always work out. They always sometimes don't work out. And so being okay as a staff member, as a researcher, as a doctor, whoever, that sometimes they'll just say, we're not interested now, in respecting that decision. In the communities we work with, no doesn't mean no forever. It just maybe they have other priorities. Where a lot of our communities are focusing on domestic violence, addiction, all these other health priorities that are maybe a little higher right now because dementia may not be a priority, again, due to how it's viewed, I guess. And maybe, a year or two now, go back and say, hey, we're back. We just wanted to follow up and see how things are going. And just being transparent and authentic, and let them know you're a resource and you're available.
Yeah, and authenticity and respecting the experiences of communities and the priorities that and the needs that they have. I think is really important. It's great to hear those recommendations. And so, Dr. Lewis, I'll just say thank you so much for your work. Thanks for spending some time with us today. And I'm hopeful that our staff in our chapter in Minnesota and North Dakota can engage you to maybe learn more detail or collaborate in ways to get information to communities, because our world, our vision is a world without Alzheimer's and all other dementia. And we always like to say in all communities. And to do that, we know we must tailor our approaches, and working with you and your team could certainly add to that momentum. So thanks so much, Dr. Lewis, and I look forward to staying in touch with you and hearing about all of your great success.
Great. Well, thank you, Dr. Hale, for the invitation, and it's an honor to share the work we're doing.
Thank you.